Newborn babies are a bundle of joy and a source of wonder, but they also come with a lot of challenges and responsibilities. New parents may feel overwhelmed and anxious about how to take care of their precious little ones, especially in the first few weeks and months. They must equip themselves with effective newborn care tips to navigate this journey successfully. However, with some basic knowledge and guidance, newborn baby care can be a rewarding and enjoyable experience. Here are 10 effective newborn baby care tips that new parents must know. 1. The power of skin-to-skin contact. The first few minutes and hours after birth are crucial for bonding between you and your baby. Skin-to-skin contact, where your baby's naked skin touches yours, offers numerous benefits. It stabilizes your baby's blood sugars, regulates body temperature, and promotes a stable heart rate and breathing. This intimate connection is also instrumental in calming your baby and aids in the first feeding. Moreover, it stimulates your body, helping with uterine contractions and milk hormone production if you're breastfeeding. Shortly after birth, your baby will receive a vitamin K shot. Vitamin K is essential for blood clotting, a process vital in preventing bleeding. Since babies are born with low levels of vitamin K, this shot is crucial for their well-being. Though it may cause brief discomfort initially, it's a small step to ensure your baby's long-term health. 2. Early tests and procedures. After the initial hour of life, your baby will receive antibiotic eye ointment, specifically azithromycin. This precautionary measure helps prevent eye infections that may arise from bacteria in the birth canal. This application is generally harmless and contributes to your baby's overall health. Your baby will undergo essential tests and procedures within the first few days. The newborn metabolic screen, often known as the PKU test, helps identify potential hormonal and metabolic issues early on. This proactive screening allows for timely intervention if any concerns arise. Additionally, your baby will be tested for jaundice, a common condition in newborns, through a bilirubin blood test. Ensuring the security of your newborn is a top priority. Your baby will have foot and arm bands featuring their name, birth date, and time. Matching bands for parents help identify both the baby and parents during any tests or procedures. An infant security tag adds an extra layer of protection, triggering an alarm if it gets too close to exit or becomes damaged. 3. Additional tests. Some newborns may face potential heart conditions leading to low oxygen levels. A painless oxygen test is conducted before you leave the hospital to ensure your baby's health. Further testing, including an echocardiogram, might be done if needed. Most newborns hear well, but a small percentage may have hearing issues. A simple screening test is performed while your baby is resting or sleeping. In case your baby doesn't pass on the first try, a repeat screening is done before you leave the hospital. Timely detection ensures appropriate measures are taken if a hearing loss is identified. 4. Hepatitis B vaccine. Before heading home, it's recommended that your baby receives the hepatitis B vaccine. This vaccine protects against a potentially serious liver infection, offering your newborn an added layer of defense against preventable diseases. Starting with a critical aspect of newborn care, the hepatitis B vaccine is recommended by both the American Academy of Pediatrics and the Centers for Disease Control. This vaccine plays a vital role in preventing serious liver infections in babies. It's essential even if the mother's hepatitis B test results are negative during pregnancy. 5. Feeding your baby. Understanding your newborn's feeding cues is crucial. Babies have small stomachs initially and need to be fed every 2 to 3 hours. Cluster feeding, more common at night, might be tiring for parents, so taking naps during the day is essential. Breastfeeding is highly recommended for newborns. It helps fight infections, lowers the risk of various health issues like asthma and diabetes, and promotes a strong bond between the mother and the baby. Lactation consultants are available to assist if any difficulties arise. Breastfeeding plays a vital role in boosting the baby's immune system and protecting against infections. However, newborns are still susceptible to illnesses, so avoiding exposure to individuals with contagious illnesses is essential. Some parents opt for circumcision for cultural, religious, or personal reasons. Understanding the risks and benefits of circumcision and ensuring the baby's health is assessed before the procedure is crucial. It's also important to check insurance coverage for circumcision costs. Keep a close eye on your baby's diapers. In the early days, meconium, a dark and sticky stool, is common. As days pass, stool color changes, indicating healthy feeding. Monitoring wet and dirty diapers also helps ensure your baby is getting enough nourishment. 6. Recognizing hunger cues. Understanding your baby's hunger cues is essential. Whether it's lip licking, sucking on hands, or opening their mouth wide, responding to these cues promptly prevents excessive crying and ensures timely feeding. Babies are also susceptible to weight loss and gain. Newborns typically lose about 8% of their birth weight in the first few days due to extra fluids and meconium. However, they start gaining weight by day 4. Regular feeding, following hunger cues, and ensuring at least every 3 hours help maintain a healthy weight trajectory. Also, babies are accustomed to being close to their mothers, having been held in the womb. While it's natural for your baby to desire closeness, avoid falling asleep with your baby in bed. This reduces the risk of suffocation and falling accidents. To ensure that this doesn't happen, create a safe sleeping environment for your baby. Creating a safe sleeping environment is paramount for newborns. After feeding, placing the baby in a bassinet ensures both the baby and parents can have a restful, safe sleep. Use a crib with a firm mattress and avoid soft bedding. It's crucial to follow safe sleep guidelines to prevent sudden infant death syndrome, SIDS, including placing the baby on its back to sleep and ensuring there are no loose blankets, pillows, or stuffed animals in the sleep space. Also, newborns have unpredictable sleep schedules, often waking up multiple times during the night. Parents should seize every opportunity to rest when the baby sleeps, especially during the daytime, to ensure they're well rested for nighttime feedings. Adequate rest is essential for both parents and the newborn. Limiting daytime visitors and designating specific visit hours can provide quiet time for naps. Requesting visitors to wash their hands before holding the baby helps minimize the risk of infections, considering the baby's developing immune system. 7. Understanding purple crying. Babies communicate through crying, which can signify hunger, discomfort, or stress. This phenomenon, known as purple crying, is normal but can be distressing for parents. Skin-to-skin contact, swaddling, gentle rocking, and soothing sounds like shushing can help calm a fussy baby. It's crucial never to shake the baby, as it can lead to serious injuries. Before leaving the hospital, parents need to learn how to use a car seat correctly, and ensuring it's appropriately installed is vital for safe transportation. 8. Burping. Burping is a necessary aspect of newborn care, as it helps the baby release the air they swallow during feeding and prevents them from spitting up, vomiting, or having colic. Newborn babies must be burped after every feeding or whenever they seem uncomfortable or fussy. Newborn babies should also be burped with gentle and steady pressure, not with hard or fast taps. The best way to burp a newborn baby is to hold them upright against your shoulder, with one hand supporting their head and neck, and the other hand patting or rubbing their back. You can also burp the baby by sitting them on your lap, with one hand supporting their chest and chin and the other hand patting or rubbing their back. You can also burp the baby by laying them on your lap with their face down and their head turned to one side. You can then pat or rub their back with one hand and support their head and neck with the other hand. Whatever way you choose to burp your baby, make sure to always place a cloth or a bib on your shoulder, lap, or hand to catch any spit up or vomit, and always listen for a soft or loud sound, or feel for a small or big movement to know that the baby has burped. 9. Bathing. Bathing is a part of newborn baby care that can be fun and relaxing for both the baby and the parents. However, newborn babies do not need to be bathed every day, as their skin is delicate and prone to dryness. Bathing them 2 to 3 times a week is enough to keep them clean and fresh. Newborn babies should also be bathed with lukewarm water, not hot or cold water, and with mild and unscented soap, shampoo, or cleanser, not harsh or perfumed ones. The best time to bathe a newborn baby is when they are awake and calm, not hungry or sleepy. Additionally, parents should also prepare everything they need for the bath beforehand, such as a baby bathtub, a towel, a washcloth, a diaper, and a change of clothes. 10. Seeking help and support. Parenting a newborn can be overwhelming, and parents need to know when to seek help. Whether it's asking for assistance from family members, contacting healthcare professionals, or joining support groups, parents should feel empowered to seek support when needed. Don't hesitate to seek support from healthcare professionals, nurses, or support persons. They are there to assist you in holding your baby during feedings, provide guidance on breastfeeding, and address any concerns you may have. New parents may benefit from community resources and support services. These resources can include home visits from visiting nurses, assistance with breastfeeding, and referrals to support groups or volunteer programs. Hospitals often provide educational materials and discharge teaching sessions to prepare parents to care for their newborns at home. This information covers various aspects of newborn care, including feeding, hygiene, and recognizing signs of illness. Conclusion: navigating the early days with a newborn requires attention to various aspects of care, from vaccinations to feeding patterns, creating a safe sleep environment, and seeking support. These tips aim to guide new parents through the exciting and challenging journey of caring for their precious bundle of joy. As you embark on this incredible journey of parenthood, these 10 tips serve as a roadmap to ensure the well-being of your newborn. Cherish each moment, and remember, you're not alone. There's a community of support ready to guide you through the joys and challenges of raising a healthy, happy baby.